Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea. I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in today to the Tate Chronicles. We come to you today with an extremely timely topic. My guest today is Hal Wolf, President and CEO of the Healthcare Information and Management Systems Society, better known as HIMSS. He has been involved in numerous relevant organizations and projects since the dawn of the digital health era. I hope that's okay, Hal. Thanks for joining us today.
It's quite all right.
Yeah.
I'm gonna get aged at some point during the conversation anyway, Jim. So we might as well get it out of the way early.
You're like me. You were probably came from days from the paper charts into faxes and beyond, and we definitely are in beyond now. You and I were supposed to be in Orlando this week at the annual HIMSS Global Conference. Last week, based on advice from your own medical advisors and information from the National Institutes of Health, World Health Organization, and the Centers for Disease Control, the conference was canceled due to those potential risks that seem to be associated with the COVID-19 virus. I can only imagine this was an extremely difficult decision made by the HIMSS team.
Yeah, Jim, without question, on one hand, it was a difficult course of action for us to take, because when you're evaluating the safety and the risk of not only your staff, but every attendee, the people back home that people could eventually go to, you have to take a very focused, evidence-based medical approach to it. And I learned that through my years in the hospitals and working with some great physician leaders. And at the same time, yes, each HIMSS is an 18-month endeavor. And this was scheduled to be a spectacular HIMSS, where we literally had our highest registration of all time, an amazing lineup of speakers and panels and educational programs, and frankly, a tremendous buzz inside the industry focused around our push to be the change, to challenge the changes necessary in healthcare on a global basis. And we were excited about it, but it became very clear to us literally a week ago Tuesday, the Tuesday before the conference began, the data shifted. And it shifted as the state of Florida declared a state of emergency, which was interesting, but the WHO and the CDC information shifted. And we could no longer look at confidence at a low-risk situation. And because we could not effectively measure the risk any longer as low, and we knew it was going to rise high, how high we didn't know, we absolutely had an unavoidable action we had to take, which was to cancel HIMSS 20. And of course, since then, it has been labeled as a global pandemic by the WHO. We made the right decision, but it was emotional because we also wanted to get together and share with our colleagues and lessons learned. You know how HIMSS is. It's an incredible environment. But the great news is next year, everyone who had a badge this year, and this is the policy, it has been for a while, we're very thrilled with it, your registration will automatically put you into HIMSS 21, which will be in Las Vegas. And of course, we will support the industry as they work hard on this virus situation with COVID-19. And we hope to have an astounding HIMSS next year in Las Vegas, and that's what we're planning on.
Well, Hal, I think as difficult as that decision was last week, the events of the last few days have really pointed out that was the right decision, as difficult as it was. Now, I know a lot of health information technology vendors and organizations such as the Office of National Coordinator and CMS. All those groups often time major announcements to be made either just prior to the HIMSS Global Conference or during the actual conference. And so what are your thoughts I know that CMS is going to probably have some big meetings. How is CMS going to get the information out that they were hoping to get out?
Well, actually, you're exactly right. Past administrations, as well as this one, often save their most important rules and announcements for HIMSS because HIMSS Global Health Conference is the largest meeting in the United States of the health ecosystem. And it's a fantastic place to introduce their messaging as well as their rules and have a conversation about it, really reaching the leadership of healthcare that the rules are intended to reach. So it's a perfect environment. This year was probably no exception. We thought coming into the conference that ONC was going to be releasing its rules on privacy on Monday. And we actually believed that President Trump, who was scheduled to speak at HIMSS on Monday, was going to be the individual releasing the outline of those rules. And then, of course, we had other panels set up with Dr. Rucker, as an example, Seema Verma, Administrator Seema Verma behind him and with him in multiple settings. So we were ready for that. And of course, just yesterday, which would have been the first day of the conference when President Trump would have been speaking, they did in fact release the rules. In the meantime, there are other announcements that have taken place, and we will continue to work with ONC and CMS, VA, and every part of the government, because we also work at the congressional level, at the administrative level, on both sides of the aisles consistently, in order to do the best thing for digital health. So one of them, which is really exciting, and I know we'll get a chance to talk about it, is in fact the announcement that we just put out about the interoperability and the global consortium for e-health interoperability. In that case, ONC happens to be one of our first members and founders. So we're very excited. We'll talk about that more in a few minutes. But back to your point, yes, we will fully expect to continue that relationship and expect more important announcements at HIMSS 21.
Okay. Well, before we jump ahead to HIMSS 21, it looks like the team at HIMSS has had to scramble, but they've come up with this concept of provide as much education as possible through a virtual HIMSS 20. What are the plans for this digital edition of the 2020 Global Conference?
Well, we're excited about it. We're not as excited about it as if we had HIMSS 20, but we're very excited about it. And let me explain why. One of the key strategies for HIMSS over the last few years is to continue to improve member value. We really want to be an incredible resource for our members around the globe. And we have been planning all along to launch HIMSS Digital, which is to take a lot of the content that is sitting in our learning center that hundreds of thousands of people access per year, expand it, begin to take in more international content. We're looking forward to refining it. We're going to be putting in CRM capabilities for individuals. We're very excited to really be able to target the type of learning, the knowledge management gain, and workforce development, and general information. So what we have done is accelerated the launch of HIMSS Digital. And we're taking the content from HIMSS 20, with permission, of course, from the original presenters, and we are presenting HIMSS 20 Digital. And it will be the precursor to the full platform of HIMSS Digital that we hope to will be rolling out later next year and this year as well. So what we're doing is we'll be looking at the educational programs. We're going to be offering the educational slots to everyone that had an opportunity. We'll be taking this over the next couple months. We'll soon be announcing schedules and presentations that would have been taking place in the exhibit booths. We're going to be looking at recreating some of our panels that took place. And we actually kicked it off today with just an amazing presentation and webinar from Dr. Amy Compton Phillips from Providence, which is at ground zero of the COVID-19 virus up in Seattle. And she just finished a 1-hour presentation, an outstanding job, walking through their experience and lessons learned in fighting this virus from an operational standpoint, from a clinical standpoint, from patient standpoint. And that was the first in our series. We'll be coming out with a whole list of opportunities for people to be able to participate And you'll be able to find this on HIMSSconference.org, www.HIMSSconference.org. So we're very excited about it. We're launching as much content as we can in the next week, and then you'll see the full schedule coming forward. So please tune in there to be able to pick it up. And again, it's www.HIMSSconference.org, and that will be where HIMSS 20 Digital will have its home.
Okay. Thank you for providing that URL, Hal. I've attended at a minimum the last 10 annual HIMSS conferences, and I've always looked forward to the different educational presentations. One of the first things I do is get out the booklet or the pamphlet or do it online and make my schedule. And frequently, unfortunately, I can't be in two places at once. So, and so I have to choose, which is often a difficult decision, what to attend. And so as you are able, I guess as much as possible with all the potential presenters that we're going to be presenting to us this week, as those are recorded and placed online, is that going to be done kind of spread out over a period of weeks and months moving forward? Or are you going to wait till it's completed and then released online? What are your plans around that?
No, great question, Jim. What our intent is we will have webinars and podcasts live with the content, and then the content will be made available so you can go in and look at it at a later time as well. So it really will become a treasure trove of information. And if you are registered for HIMSS 20, you'll have access to it through your current credentials. And if you weren't registered, we're working on a plan to figure out how to allow people to gain access. As you know, we really have been, you used the word scrambling, and I think that's right. I've never seen an organization work so hard and diligently to come up with an alternative to an event that is, of course, it's not going to get replicated, but to take the best of wherever possible. Where 45,000 people were coming together, 300 plus educational programs. People put a lot of time and effort and love into these real nuggets of knowledge management to be shared. So we'll have it out there, and we will have it posted, and people will be able to go in and see it and learn in both real time and on their own time.
I'd like to switch gears for a couple of minutes here, Hal.
Sure.
I know you have a extensive background in health information technology and really have seen the ramp up and trajectory of electronic health data and interoperability. It seems that the current COVID-19 outbreak really is demonstrating the need for these types of applications and processes and products that HIMSS has encouraged for decades. And so I'd like to talk with you a little bit about that. That's, telemedicine, electronic reporting labs, all those kind of things. We're seeing the real benefit of a lot of work that's been done over the last couple of decades.
Mm-hmm. Agreed. So if you go back 2 years ago, we made the board of directors, which of course, let a half step back to remember that HIMSS, of course, is a membership-based organization. We have over 80,000 members globally, and we're a nonprofit. We focus on the topics that we believe are critical for really driving healthcare and the reform of healthcare globally. And we made a really critical change to our mission statement. And that was we took IT in the mission statement and we called it the power of man, and we split it apart to make it information and technology. So our mission statement is to reform the global health ecosystem through the power of information and technology. This virus attack has epitomized the need of why we have to have records, why we have to have information that can move swiftly, why we need to know and to be able to aggregate critical clinical data at scale to understand the size of any outbreak that is occurring, and for the protection of individuals wherever they may be, to have access to their information that can be used. The technology side is going to continue to develop, and we've made huge investments in it, but now we're starting to take advantage of the information. One of our big obstacles, of course, is interoperability. And this is why we put the global consortium of e-health interoperability together, so that there are fundamental standards globally of common APIs for the exchange of information, not only in bulk, but down to the device level. And so getting HL7 International and IAG International together as partners to form the global consortium of e-health interoperability, ONC joining, the Netherlands, the WHO has committed to joining as well. We're very excited about it because this global pandemic, it just absolutely nails why we have to have information no matter where you are in the world. And our vision has always been to realize full health potential of every human everywhere, and we're going to do that through information. So we do take it seriously. You're absolutely right. This has been what HIMSS has been dedicated to for decades, and it's both reassuring to know that what you have been focused on is needed, and it's both tragic and always sad when you have an epidemic and a pandemic of this nature, which drives home the point. But we're here to help, and we're here to lead, and we're here to work with systems around the globe to do whatever we can to support them.
And, just to speak for a few moments about some of the details of these different venues, for lack of a better word, of technology, the electronic reporting of labs, we may not have an accurate number of how many COVID-19 tests have been performed, but we have an accurate number of positive results. And that can be reported and gathered very quickly to drive important decisions by the that powers that be, no doubt about that. It's all part of public health surveillance. I'm involved in the certification of electronic health records for a long time, and everybody was always saying, well, why do we have to have that technology for public health surveillance to report these things? Well, we know why now. And to have the registries to report this type of information too. And of course, telemedicine. Telemedicine has, in some ways, been a fantastic application looking for a perfect reason to exist. And there's all kind of reasons. And, everybody got kind of focused on, well, will there be reimbursement? Will there not? All those kind of things. All that in a situation like this with COVID-19, telemedicine is a great way where if somebody has internet access and a laptop, they can hopefully communicate with their provider and not have to go to the practice to report things. So
you are absolutely right. In fact, that was a point that Dr. Compton Phillips made today as they're dealing with Ground Zero up in Seattle. They are encouraging telehealth in every possibility. 1 in 10 of the individuals who have been tested positive for the virus at this point are healthcare workers. And part of the problem is the way the testing procedures are set up, especially in the United States, where we force a test of flu, type A flu first, which is normally a swab in the mouth, the nose, etc. And that creates an airborne version if it happens to be COVID-19. So we are going to see the healthcare industry hammered from a personnel standpoint of infection, which is not going to help. So being able to shift to telehealth and do more from home, it's no longer a luxury. It's going to become an imperative.
Mm-hmm.
And we also see a whole sophistication now in work from home coming up in the government, companies around the United States. I think the acceptance of telehealth and the expectation of it is going to move even more mainstream than it has before, Jim. I think at one time people thought of it as a convenience thing. I can see my doctor,
Sure. Yeah.
Novelty, if you would. But now it has to be integrated.
Absolutely.
With the expectation that it's going to take on a significant portion of care.
Yeah. There's no doubt about that. How it was seen almost as while important, not a primary important development. Everybody wanted to go actually visit with their provider in person, have that personal encounter. That's risky in terms of what's going on right now. So I think the technology already exists. The process already exists, and I'm sure it's being used more and more really on a daily basis now. You would certainly hope so.
Yes,
Yeah.
without question. And for those organizations on scale that have gone there, and Kaiser Permanente, where I had the fortune of working for quite a while, significant portions of their care is delivered through telehealth and contact with patients. And I think you'll see it now all the way down through the rural hospitals, where it becomes even more imperative from an access and quality standpoint. And it's one of the, if I may, one of the more interesting challenges has also been around digital health and now its maturity. And one of the things that's critical for HIMSS, you'll be hearing more and more of this announcement coming out, but just a few weeks ago, we launched a more thorough definition of digital health. And behind it, we're going to be launching a digital health index, which really allows health systems towards a proactive, predictive health modeling capability. How do I develop a sustained population health engagement with our consumers and with our patients? How do I do that using digital tools? So many systems have not gotten to the level of sophistication, and we've put together an entirely new, it's even more than a maturity model. It's a full index, which encompasses everything from infrastructure to quality outcomes, all the way through connectivity. How are you set up from an operational standpoint? It really is an end-to-end capability, which is fundamentally designed to help transform the care delivery platforms. So we're very excited about it. We were going to do a full-scale presentation of it at HIMSS 20, and that will be one of the items that'll be coming up on HIMSS 20 Digital.
You know, it seems like that HIMSS was getting ready to make some giant steps forward, and this recent situation has caused those things to occur even quicker. This whole shift to a more expansive digital model and communication and online content. If you go back to something we said a little bit earlier, we only have about 3 or 4 more minutes, Hal, and I want to touch base on it again. You had mentioned this interoperability kind of consortium. Tell me a little bit more about that. Yeah, I'm interested in that.
Sure will. Jim, I think one of the most important challenges that we have had, not just HIMSS, but the industry as a whole, and certainly HIMSS has been one of the vanguards, has been trying to get the information and the data flow from an interoperability standpoint. Over time, there have been a couple of key standards. Continua, which was supported by HIMSS, IHE, also supported by HIMSS, HL7, good partnership. But the use of those three, and then particularly HL7 and IHE, they have been growing, but they had not really been adopted from a standard point of view in full scale the way we would have liked. And partly because they're so flexible in their infrastructure, you can take them and you can build your own. There really wasn't a place where people could go and find best practice. You know, do I have to reinvent the wheel? Do I have to take the HL7 framework and sort of create it for myself? So we got together with HL7 and IHE and HIMSS, and we sat down and said, we need to fix this. We need to come together. We all have pieces of the standards that are important, and we have frameworks that continue to develop. So the idea was put together of a global consortium for e-health interoperability. And immediately the Netherlands said, well, we're very interested in this. We want to sign up. Don Rucker, ONC, same thing. The Global Digital Health Partnership, which is 40 countries from around the world, same goal, let's join. Recent conversations with the WHO. So we are creating a website. It's already out there, and we'll get you the link and allow you to put it up. But we have a website which will now begin to pull together best practices, standards. It'll be indexed, and an individual in a hospital or at a system can look up and say, here's my use case. What combination of standards have been used? Do I have to reinvent the wheel? And it allows for us to keep national, regional, and even local interoperability initiatives up to date on the latest information and a resource for them to use. So we're very excited about it. We're putting it out there. We'll do a formal launch in the next couple weeks with ONC back in Washington, and we're excited about it.
Well, I appreciate you going into the details of that, Hal. It's obvious that HIMSS is really expanding the mission to include the search for solutions to some of these great challenges. And really, in terms of electronic health records, transmission of that data, there's no bigger challenge than interoperability. There's no doubt about that at all. Hal, unbelievably, our time has totally elapsed. I can't believe how quickly it's gone by. But I want to thank our audience for joining us today on this episode of the Tate Chronicles. I offer a special salute to my guest, Hal Wolf, President and CEO of HIMSS. Hal, thanks for coming aboard today.
Absolute pleasure, Jim. Thank you for having me.
You can find more information on this show's program page at healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.